health and a little wealth and a lot of love.
The question I have is, once you get this surgery, is there some sort of plateau effect that happens? Or do we talk about that later? And should I hold that question then?
No. And
Okay.
it's there is a plateau. You can expect to lose I would say 2 to 4 pounds a week initially for the first several months. And then
Wouldn't that be glorious?
the weight loss will start to definitely decrease over time. And to the point, I want to say a year and a half post-op is when you probably reach your plateau.
Gotcha. It's a year and a half. Gotcha. Because I remember watching these 1,000-pound live, Dr. Now, 1,000-pound sisters, and they say like the first few months you just go at it because it's going to pull weight off of you, and then 6 months, but then you will not have that same effect if you wait out. So some people weren't hitting their goal weight, and they're and they had like different goals or whatever, and they weren't hitting that, and the doctor was saying, listen, like this is the prime time to do it. You went through all that, all the pre-op stuff, which you have to like you do psychology and a lot of things you got to do prior to, right? Now you fact check me if reality television is not right, but that
No, but I would say those shows, because they also the surgeon is also part of the show, and so you see a little bit behind the scenes there too. But a lot of times, if you're not on track, if you're not losing the weight at the speed that you're supposed to be losing it, it typically means that there's some lifestyle stuff going on that maybe you're not following the recommendations.
Right.
With a little health and a little wealth and a lot of love. That's the life that we live. Suits and scrubs.